Peace be to you all. Assalamu alaikum. Omar here. I'd like to talk to you guys briefly about the concept of knowing it all in medicine. Now, in medicine, it is impossible to know it all because it's so broad. That's why we have specialists like cardiologists for the heart, nephrologists for the kidneys, urologists for the male and female genitalia, things like gastroenterologist for our alimentary system. So you're not going to know it all. And then even with the specialist, you also have subspecialists. So you might have somebody who is like Dr. Ben Carson, who is a pediatric neurosurgeon. So he's a neurosurgeon, but then, he used to work on children. So pediatric neurosurgery, a pediatric oncologist. So an oncologist who specializes in cancers that children get. So, I say that because I saw some friends of mine, and I was talking to them about medicine, and they were like, "Wow, you must have seen it all." And I said, no, not even a fraction. I don't even think I've seen a fraction of a fraction of a fraction in medicine. There's so many different things to see. It's because it's the human body, and we're subject to assaults, whether that's internally or externally. So there's whole different fields of medicines, parasitology, and different types of infectious disease subspecialties and immunology. I mainly deal with internal medicine as a physician associate, I should say. We used to be called physician assistants, but as a PA, I've just dealt with adults. I've taken care of adults, so that's internal medicine, and specifically things like metabolic syndrome, so hypertension, diabetes, hyperlipidemia, and obesity, and then things that folks get from abusing their bodies from years of cigarettes. So COPD, other things like liver disease from alcoholism. But even that, you got to consult with a GI specialist. So one of the things that I do to kind of keep abreast of my knowledge is I read. So, I've got physical exam and history taking. I can't forget how to use the stethoscope, the reflex hammer. I've got a lot of patients that come in with complaints about hearing problems. So I need to know how to, at least on a rudimentary level, assess them and then refer them to a specialist. Reading books like, this is an old textbook. This is a National Medical Series for Independent Studies. This is really for the USMLE exam. As a PA, I wouldn't be taking the USMLE exam, but I like the way this book is formatted because it gives you chapters based on diseases, so pulmonary diseases, hematologic, gastrointestinal, and then at the end of each chapter, it's got quizzes. So I find that having to answer the quizzes helps reinforce my knowledge, especially if I get the answers wrong. So right now I am trying to get my recertification is due in 2023 or 24. So I've got to take my boards, my PANRE, so the Physician Assistant National Recertification Exam. I'm not looking forward to it, but I got to take it. So I'm trying to keep my knowledge base up. And my license is due for renewal by the end of this year, December 31st, 2022. So I'm in the midst of getting a lot of CMEs, so that's continuing medical education credits. So I've got to read journals and listen to a bunch of lectures that I don't necessarily want to listen to after a hard day's work or on my weekend, but I've got to, and then attending conferences. So as a PA, I've got to get 50 Category 1 CMEs or continuing medical education credits and 50 Category 2s. So the Category 1s have got to be certified by credentialing body like the American Academy of Medicine, things like that. You know, I find it a bit tedious and exhausting, especially while I'm trying to work a full-time job. But these are one of the things that you got to do if you're going to be not necessarily a master of your craft, but as competent as possible. You know, you owe it to your patients, and you owe it to the hard work that you put in to get to this position. You know, whether you're a PA, an NP, or an MD. But that's it for now. Just know that it's, you know, being a clinician or a healthcare provider, it's never ending in terms of garnering your knowledge and reinforcing your knowledge. That's one of the things that attracted me to this field. But if you have any interest in becoming a PA like me, please feel free to reach out to me. I'll leave my contact information in the descriptions. I was a college professor many years ago, so maybe you'll find my advice to be of some value. All right, take care. I wish you guys the best of success in your positive endeavors. Peace.